Welcome back to Thriving Thursdays. Back on our couch. We were not on our couch. We were celebrating you.
Oh, me. Happy birthday to me. Yay.
Happy birthday, Aaron. I
Thank
still don't
you.
think I've actually done a wife post.
Oh.
A work post.
Yeah, I've actually been waiting for that.
Same. That is our life now. Anyway, today's Thriving Thursday, I wanted to talk more about prolapse.
Oh.
This can be for men and women.
Yep.
It's not always postpartum.
Nope.
But
Nope.
Isn't that a song?
Probably. I'm just a hype man.
Nope. It totally is. We should play it. I don't know how to do that. But I wanted to talk about it because I do treat people with prolapse very often who are postpartum. And then more specifically because I was on the Birth Queens podcast and like everyone's loving it. So if you didn't get a chance to listen to that, I think it's like 47 minutes long. If you didn't get a chance to listen to it, I'm not sure if I'm gonna talk or like write it out so you can see just some little tidbits of info on pelvic organ prolapse, and let me know if you have questions from that. But that's it. Okay, this is a thing. I've made a 13-minute and a 10-minute video talking all about prolapse. Listen for sure. Please listen to a podcast on Birth Queens. BARTHKWEENS with Allie and Carly. We talk about it for like 45 minutes. I'm having a really hard time keeping this short. So I'm really gonna try hard right now. So listen to theirs because they're just gonna have all of the information. It's way more fun to listen to all three of us talk than just me. But I want to talk about prolapse because it is pretty common, at least in my practice. And of course, I'm seeing the people who are coming for that. So if we talk about the likelihood that it will happen postpartum, I don't have those numbers, but I know that I treat a lot of patients with it, or a lot of clients with it, and it ranges from, so prolapse is like, it's kind of like a ranging thing. So it can range from just even feeling heaviness in the pelvic bowl. So here's your pelvis, pelvic floor, right? We have our organs in here. Whoops, they just fell apart. Sorry, but you have your organs in here, your bladder, your uterus, your vaginal canal, and then the rectum and the anus, right? They're all being held up by your pelvic floor, and then your core is up here helping to hold it from the top. So prolapse can range from just feeling like a heaviness here, a bulging pressure, to something actually coming out, like a balloon looking type thing coming out of the vaginal opening. Something can actually come out of the anus as well, but we're gonna stick to the vaginal opening. And actually sometimes at the urethra, the pee hole here too, you can feel like pressure and see a little more tissue coming out there. That's called a urethrocoele. We're gonna kind of skip over that for now, even though that is something that is common that I treat. So what types of prolapse are there? I have a cool picture from my GFAM people at Pelvic Guru and Tracy Scherer. Thank you so much for them. So the pictures are of a cystocele, a rectocele, an enterocele, a uterine prolapse, and a vaginal vault prolapse. Again, the urethrocoele and the rectal prolapse are things, they're just not on that picture. And so, for instance, because I don't want to go for 13 minutes, a cystocele is when the bladder, the back of the bladder, pushes on the front of the vaginal canal. So this is sideways. When the back of the bladder pushes on the front of the vaginal canal, and then that tissue from the inside of the anterior vaginal wall presses down or all the way out, okay? And I want you to think about that when you're looking at all the other pictures, because it's not actually your bladder falling out, or it's not actually your rectum falling out, okay? The uterus is that descent or that prolapse that actually is falling down, okay? But the bladder and the rectum are pressing on, or the enterocele is pressing on the vaginal tissues, the vaginal canal. How common is this? We already talked about that. These are just things I wrote down that we talked about during the podcast. So I wanted to try to give you the condensed version. Diagnosis. So things for you to look and feel for. You're gonna feel for heaviness, bulging, sometimes pain, but usually more of a heaviness, bulging, full type of feeling. And the things to look for are like get in front of the mirror. You can either do it standing over it or lying on your back holding it. And you're gonna part the labia and see if you see anything that wasn't there before. Sometimes it looks like a flat, smooth ball kind of, or sometimes it does have a little rugae on it, which are like little wrinkles. But it wasn't there before. It shouldn't be there now, though it's super, super common, especially in the first like 40 days, because your body just went through a bunch. So don't freak out too much. You can call me, but those things should be getting better. So if that sensation or the prolapse is not getting better over those 40 days, or at least after those 40 days, you might have some prolapse issues. Treatment for it: physical therapy for sure, obviously. And we work with stages, or at least I work with stages 1 through 3. There are 4 stages. Sometimes by the 4th stage is when it's like really falling out, and that will often need surgery to help like pick it back up. But you'll still need physical therapy to address like maybe the issues that were contributing to them being there in the first place. Yes, there was a baby that you were housing, and yes, you delivered a baby, whether C-section or vaginally. So we look at the things other than that, which are your biomechanics, like how you're moving your body, how you're lifting things, and how you're breathing, how your posture is, because all of those things play a huge role in that. I can go on forever about that. Go listen to the podcast, because this will be another 10-13 minute one. Yoni steaming is also really, really great. And a pessary can help. It's like a little plug kind of. There are a bunch of different shapes and stuff, but to hold things up for you and see if that helps you with your symptoms. It's also super helpful to then strengthen with that in. So last thing is prevention. Prevention is, I think, again, like our physical therapist wheelhouse, where we go back to why is it there in the first place? Because I've definitely treated people who are not postpartum that have prolapse, and it's because of their breathing pattern is backwards. We should be inhaling, expanding, exhale, decompressing, right? Sometimes that's backwards, or we're kind of stuck in this like state of like anxiety, and that can have a big effect on the pressurized system. Your abdominal and pelvic cavity is pressurized, so we want to keep that flowing. So prevention in making sure you're breathing well, prevention in your body mechanics, and that you're not squishing or pushing out as you're standing in whatever posture or moving, and you're not bearing down as you're picking something up. Sometimes you can't tell you're doing those things. Oftentimes you can't, because it's your normal. So pelvic floor therapists are really, really great at helping find those issues and then treating them. So I hope that helps. I'm going to put up some pictures to help explain this even more, but even more so, just go listen to the podcast. But thanks for listening.